The humanitarian crisis is getting worse every single day. Even before the escalations today, there was not enough supplies getting into Gaza. In Rafah right now, there's an estimated 1.3 million people that are sheltering there. Now, this is beyond the capacity of Rafah, which means that there's literally nowhere left to go. When you look out in the sidewalks, there's tents everywhere. People are sheltering in Rafah because there is nowhere else left to go.
Mm.
Insufficient supplies, the continued attack on healthcare. For example, NASA Hospital. Again, kids are getting injured every single day with the increased escalation in fighting, with the malnutrition rates increasing because there isn't any food. Again, the latest reports indicate that every single person in Gaza is food insecure. You have a situation where 1.3 million people are living either in a shelter, in a tent, being exposed to the elements, without healthcare, without adequate food, malnutrition, public health emergency on the brink of exploding. Again, we see diarrheal diseases everywhere. We see lots of kids turning up to the health centers with jaundice, but we don't know if it's hepatitis because we can't test for it and we can't treat for it. This means that it's almost impossible to do the work that we need to do.
So Jason, how are people getting their food, and how genuine is the risk of famine?
You see situations now in Rafah where any aid convoy, any truck that comes in is under threat immediately of the population. They're trying to grab whatever they can. It shows the desperation of the population. It is critical that we allow in much, much more food. Again, 100, 200 trucks is not going to keep 2.3 million people alive when 85% of the population are homeless. There isn't enough food to go around. We need the commercial sector back. We need the ceasefire because, again, we see every day hundreds of civilians turning up to the health centers with trauma-related injuries. That means that primary healthcare, I mean, kids that get sick, there's nowhere for them to go. The hospitals are bursting. There's not enough medication, no supplies, not enough healthcare workers. Access is becoming increasingly difficult.
How is this crisis compared historically to others when it comes to food insecurity?
I think what marks this crisis different from others is one, the complete lack of adherence to international humanitarian law and the normal frameworks that exist that allow humanitarians to do our jobs. Right now, we can't. So in other conflicts, other crises, people can move. In Gaza, there's nowhere for them to go. They can't leave. Civilians have been moved around all of the Gaza Strip like pieces on a chessboard to fulfill military objectives. The notion that they're being moved for the protection is a fallacy. And we've seen this by the evidence. You see this in the numbers of civilians, of kids and women getting injured and killed. 7 out of 10 of the civilians that have been injured has been a woman or a child. They're being asked to go to areas that cannot keep them alive. I mean, Rafah had 280,000 people before October 7th. It now has 1.3 million people. There isn't enough space. There's no infrastructure there to keep those people alive. And so unlike other crises where, your civilians can move to other locations, humanitarians are able to bring in the goods that we need, the quantities that we need to move around. This is not at all present in Gaza right now.
If I can just ask you there, Jason, you mentioned the other locations. There are reports, one in the Wall Street Journal, that Egyptian authority is fearful of a further Israeli military push into southern Gaza might set off a flood of refugees, and they're reporting that a walled enclosure 8 miles long in the Sinai Desert near the border is happening. Do you know anything about that?
Look, we've had reports as well, and we can see that the fortification of the walls are being done. Again, I can't comment on what the intention in it, but it's very clear that the civilians that are now in Rafah, and many of them were told to move south, were told to move from Gaza City, were told to move from Khan Yunis, that they would be safe in Rafah. There is nowhere left for them to move. I mean, it's either going south and the walls are there, or being pushed into the Mediterranean. Again, there is absolutely nowhere that is safe in Gaza right now, and there is nowhere for the 1.3 million people in Rafah to go.
Just finally, the UN Agency for Palestinians, or UNRWA, has had its funding suspended due to allegations staff were involved in the October 7 attack, just allegations. But what has this suspension done to aid being distributed, your work that you're doing there?
Look, all of these allegations are serious, and UNRWA are taking the right steps in doing investigations to verify them. What the suspension means is that it has really hampered the ability for humanitarians to deliver assistance. UNRWA is one of the largest agencies in Gaza. They have 13,000 staff. They run 50% of the schools. They run a vast number of primary healthcare facilities, and hundreds and thousands of civilians are sheltering in the UN buildings, in the UNRWA facilities. If UNRWA is not able to operate, there is no possibility for the remaining humanitarians to deliver assistance to the scale and to the scope that we need to. Again, the 1.8 million people that are displaced, they need assistance every day just to stay alive. Without the logistical, the infrastructure support of UNRWA, without the staff of UNRWA, it would be impossible to deliver humanitarian assistance.